Hello and welcome. If you or a loved one are facing external beam radiation therapy for prostate cancer, that path ahead can seem, well, pretty complex. Today, we're going to walk through this whole journey together. We'll use this guide to make everything crystal clear, step by step. So let's get into it, starting with the biggest question of all. Why radiation in the first place?
Our goal here is really simple. It's to give you the information you need so you can feel prepared and, honestly, a lot more confident. Think of this as your personal roadmap, designed to make this whole process way more understandable and manageable.
And let's start with the most important thing. Radiation therapy isn't just an option, it's a cornerstone of prostate cancer treatment. It's a powerful tool with a super clear purpose, to either cure the cancer completely or to get its spread under control.
So first things first, let's really get into the why. In what specific situations is radiation therapy the path that doctors recommend?
Well, your doctor might bring up radiation for a few key reasons. It can actually be the main treatment if the cancer is still just in the prostate. For what they call high-risk disease, it's a really powerful choice. It's also used after surgery if PSA levels start to creep up, or in more advanced cases to help manage symptoms and really improve quality of life.
Now, this is absolutely crucial to understand. This is not a one-size-fits-all kind of deal. Your treatment is going to be tailored specifically for you.
Literally everything about your diagnosis, from the cancer stage to your Gleason score, is taken into account. And just as important, your own personal goals and priorities are a huge part of the conversation. This makes sure that the plan you get is the absolute best one for your unique situation.
So your treatment will likely be one of two main types, SBRT or IMRT. And as you can see, the difference is pretty big. SBRT is this high-dose, super-focused treatment that's all done in just 5 sessions. I mean, how convenient is that? On the other hand, IMRT is a more gradual approach spread out over several weeks, and it's often used for higher-risk cases or after surgery. The main takeaway is that your specific diagnosis is what points the way to the right path for you.
You might also hear your doctor talk about ADT, which is hormone therapy. The easiest way to think of it is like a teammate that makes the radiation even more effective. What it does is lower testosterone levels. Now, depending on your risk level, this could be a short-term thing for a few months or a longer-term plan. For guys with low-risk cancer, it's often not needed at all.
Okay, once your plan is set, the next step is getting ready. And trust me, knowing exactly what to expect before your first treatment can take away so much of the anxiety.
Before you even start, you'll have what's called a simulation session. This is where the team creates a super precise map of the treatment area using a CT scan. The level of detail here is just incredible, and it's all for one reason: to hit the cancer with pinpoint accuracy while keeping all the surrounding healthy organs as safe as possible.
There's also a little bit of daily homework you'll need to do. For each session, you'll be asked to have a full bladder and an empty rectum. And this isn't random. It's actually a really simple but super effective way to shift other organs out of the beam's path and to keep the prostate perfectly still, which is just key for an accurate treatment.
So what's a treatment day actually like? Let's walk through what the daily routine really feels like.
For those of you on the SBRT plan, the entire course of radiation is just 5 sessions. I mean, think about that. Your whole treatment could be done in just 1 week. It's a compressed schedule designed to be incredibly effective while causing as little disruption to your life as possible.
Now, in contrast, the IMRT plan is more of a gradual journey. It typically involves anywhere from 20 to 45 daily sessions over several weeks. And yeah, it requires a longer commitment, but this methodical approach allows for really precise, modulated doses of radiation, which is often crucial for more complex or higher-risk cases.
But here's the thing to remember. No matter how many sessions you have, first, the daily appointment is quick, usually under half an hour. And second, and this is the most important part, you won't feel a thing. The radiation itself is completely painless.
Okay, let's talk about the thing that's on everyone's mind: side effects. The really good news here is that they are almost always temporary and very, very manageable.
You can see there's a pretty clear pattern here. For the first couple of weeks, you'll probably feel pretty normal. The side effects tend to ramp up and peak in the final weeks of treatment. But look at that last part, because it's key. Within a few weeks after your final session, things start to gradually get better. Recovery has a rhythm, and it's a predictable one. And you are not on your own with this. There are simple, effective ways to handle every common side effect, from medications to small changes in your diet. But the most important strategy of all, talk to your care team. They are your partners in this, and their job is to help you manage every single aspect of your comfort and recovery.
So, the treatment's done. What happens then? Let's take a look at the long-term plan for life after radiation.
Your care does not stop on your last day of treatment, not at all. You'll have regular follow-ups to monitor your PSA, to check in on how you're feeling, and to help manage any effects that might be lingering. It's a whole plan designed to make sure you stay healthy for the long haul.
That's a fair question, and one we need to address. Some men might experience mild, long-term changes in urinary, bowel, or sexual function. But the key words I want you to hear are mild and manageable. Modern radiation techniques have dramatically reduced these risks, and there are so many effective ways to manage any changes that do pop up.
And that really says it all. At the end of the day, this is the philosophy behind modern prostate cancer treatment. The goal isn't just to zap cancer cells, it's to protect the life you've built. It's a journey of incredible precision, careful planning, and true partnership. So as you move forward, the question isn't just how will we treat this, but how can we make sure you continue to live well for all the years to come.